This is the AV lecture for Lab 10. In this AV lecture, we'll be discussing the axial skeleton. The axial skeleton is represented in blue on this image on the right here. And the axial skeleton is made up of 80 bones, and this includes all your vertebrae, ribs, your sternum, your hyoid, and your skull. We're going to start with the vertebral column, and there are 5 regions that make up the vertebral column. The most superior is called the cervical vertebrae. Then you have the thoracic vertebrae, followed by the lumbar vertebrae, then the sacrum, and then your most inferior region of the vertebral column is called your coccyx. In between, for these first 3 vertebral regions, in between each vertebrae are intervertebral discs, and these discs are essentially cushions, and they're made up of fibrocartilage. In your cervical vertebrae, you have 7 individual vertebrae. Your thoracic, you have 12, and in your lumbar, you have 5. And a nice way to remember this is that at 7 in the morning, you eat breakfast, so 7 cervical vertebrae. You eat lunch at 12 p.m., so 12 thoracic vertebrae. And you eat dinner maybe at 5, so 5 lumbar vertebrae. The spine is naturally curved, and that curve changes throughout your life. When you're first born, you have this very pronounced C-shaped curve, and we call this the primary curvature, and that's about a 1-degree curve. But then that curve changes and develops as you age. And then each region is going to take on a different type of curvature when you become an adult. And so as you, when you grow and you're actually able to lift your head on your own, this causes a different type of curvature at your cervical vertebrae. And this is about a 2-degree curve. And then when you learn how to walk, this causes another type of curve. This time it's in your lumbar vertebrae. And this is about a 2-degree curve. And so when you become an adult, your vertebrae naturally forms this S-shaped curve, and there are about 4 different curves in each of these vertebral regions. The cervical curvature, we call that a convex curvature. Your thoracic forms a concave curvature. Your lumbar forms a convex, and your sacrum forms this concave. And so you have this S-shaped curvature to your vertebrae, switching between a convex and concave curvature. And that's all part of the natural curvature of your vertebral column. Now you can form some abnormal curvatures, and those are indicated here. Scoliosis is shown on the left, and this is due to a lack of proper development of one of your cervical vertebrae, and this causes the vertebrae to deviate from the midline. This middle image is representing kyphosis, and this is also known as hunchback syndrome, and this is caused by osteoporosis that affects the thoracic vertebral region and kind of gives you this more dramatic curvature of the thoracic vertebrae. And then finally, lordosis can be caused by a weakening of the abdominal muscles, and this causes an exaggeration of the lumbar curvature. And this is pretty typical of women who are pregnant. And you can have varying degrees of each of these abnormal curvatures. And we call them abnormal curvatures, but a lot of people are affected by these curvatures, and I myself have slight scoliosis, and it's just they're varying degrees of each of these abnormal curvatures. Let's go into just the general structure of vertebrae. This image is of a typical vertebrae here, and this bigger portion here, this is called the body of the vertebrae, and this is in this little depression here. This is where we're going to have that fibrocartilage, those intervertebral discs in between two vertebrae, and we also have this hole here. And recall that in anatomy and physiology, holes are called foramen, and this is called your vertebral foramen. And this is where your spinal cord is going to pass through. So when your vertebrae stack up, those holes are going to overlap, and that allows the spinal cord to pass through. Your vertebral arch is indicated here, and this is made up by two pedicles. I'm indicating one here, but there's also one here, and two lamina, and the four of these structures together form this vertebral arch here. And then you also have processes, and recall that processes are just projections from a bone. And so your spinous process, this is going to be the posterior portion of your vertebrae. And you also have transverse processes on some vertebrae, and those are processes that are extending out in the transverse plane. You also have processes above and below vertebrae. Here I'm indicating the superior articular process. And on that process, you're going to have a facet. And a facet is just an area where there will be cartilage. And this suggests that this is where vertebrae are going to be connecting. So you have connection or articulation at the body of the vertebrae, as well as at the superior and inferior articular facets. And let's look at those features some more. We have, again, the spinous process that's coming off. So this is the posterior side of your vertebral column. If you were to just feel down your spine, what you're feeling is that spinous process. And then, particularly for articulation, we have these articular facets that we just briefly discussed. But here they are again. Here's the inferior articular facet. This is going to be on the inferior side of the vertebrae. And then our superior articular facet, and that's going to be on the superior side, or on the top of the vertebrae. And this is where we're going to have vertebral articulation. So there's going to be three spots. There's going to be the inferior, the superior articular facet, and then the body of the vertebrae are going to come together. And notice that the inferior articular facet of this vertebrae, T8, articulates with the superior articular facet of T9. This is the vertebrae just below. When these vertebrae articulate and stack onto each other, we form this intervertebral foramen. And in general, the spinal column is going to extend down through the main vertebral foramen, and then you're going to have these peripheral nerves extending out from the spinal column, and this is how they're going to extend out to other parts of the body through this intervertebral foramen. Here we're indicating those intervertebral discs so we can see where that fibrocartilage is going to be found in between two vertebrae. And these, just some more discussion on this. This feature is going to absorb shock. It's going to prevent these bones from rubbing together. And they are going to be affected by gravity. And so an interesting fact here is that you are taller, relatively taller in the morning than you are at night. And that's because of compression of these intervertebral discs. throughout the day, your body weight is going to compress these intervertebral discs. And that compression gets relaxed at night when you sleep. Now, intervertebral discs are prone to injury, and if you've ever heard of a slipped disc or a herniated disc, this is when that fibrocartilage bulges out in between two vertebrae. And this causes immense pain because the fibrocartilage is pushing against the spinal cord, and this causes a lot of pain. And this is typically, you typically experience this in the lower regions, particularly in the lumbar region, L4, L5. And that's because that's where most of your weight is concentrated. So there's a lot of pressure, a lot of stress put on these discs. And so it's typical for one of those lower lumbar vertebrae to actually herniate. And in these images here, we see figure 1 is representing healthy, normal intervertebral discs. But then figure 2, down here in these lower lumbar vertebrae, we're actually seeing one of these discs has been herniated. And this lighter column coming down here, that's your spinal cord, and we can see that this disc is actually pushing up against that spinal cord. Now, to repair this, you do need to have surgery either to remove the whole disc and fuse the vertebrae, or you can just remove part of the intervertebral disc that is pushing against the spinal cord. Let's talk about specific vertebrae now. We're getting into cervical vertebrae, and there are going to be some differences in how these vertebrae look between each region. Now, the cervical vertebrae, the first thing we notice is that there are 3 holes here. We have our main vertebral foramen, but then we also have these 2 others here, and these are called the transverse foramen. So cervical vertebrae from C3 to C7 have 3 foramina, vertebral, and then 2 transverse foramen. We also notice that the spinous process of these vertebrae is forked, or bifid, and that's unique to C3 to C7. And then also, if we look at the spinous process from a lateral view, we see that although it is facing slightly inferior, it's mostly level. It's relatively level, and we'll compare that to other vertebrae, and we'll see that it is in fact sharply pointing into that posterior position. Now another thing to note here is that our articular facets, the superior articular facets, which again is where vertebrae are going to be connecting, these are mostly facing superior. And this is going to be different than other vertebrae. Now our first 2 cervical vertebrae, C1 and C2, are unique and a little different from the other cervical vertebrae, C3 through C7. And they have unique names. C1 we're going to call the atlas, and this bone supports the skull. These superior articular facets connect with the occipital condyles, which are those condyles on the inferior side of your occipital bone, just on either side of the foramen magnum. And this bone is important because not only is it going to support the skull, but this is also going to allow us to make the movement of nodding our head yes. Now C2 is called the axis, and this is going to be just inferior to C1. And we have a feature here called the dens, or the odontoid process. And this is going to be found just here on when these 2 bones articulate. And there are going to be ligaments running that hold the dens in place with the atlas. And this bone is unique in that it allows us to shake our head like this and say, make the motion no. And so this is what these two bones look like articulated. This again is the atlas. This is C1. This allows us to make the yes gesture. And then C2, the axis, allows us to make the no gesture. Now moving into the thoracic vertebrae. This is, again, the region just inferior to your cervical vertebrae. We notice right away that we have a vertebral foramen here, but we have lost those transverse foramen. So these do not have a transverse foramen. That is unique to cervical vertebrae. The body is relatively more massive than the cervical vertebrae. And let's look at the spinous process here. If we compare that to the cervical vertebrae, we see that this is really sharply pointing inferiorly, much more so than the cervical vertebrae. Now, our superior articular facets, on the cervical vertebrae, they were facing superiorly, but now they're facing posteriorly. They're facing sharply posteriorly. So this is another feature that's unique to thoracic vertebrae. And then in the thoracic region, this is where we're going to have ribs articulating. And so we need to have features where ribs can connect to these vertebrae. And we call those superior costal facets, the inferior costal facet, and the transverse costal facet. Now, facet, again, is just an area where there's cartilage and two bones are going to be coming together. And costal refers to ribs. Anytime you see costal, think about ribs. And these costal facets are all about rib articulation. The articular facets are all about vertebral articulation. So these are going to be where vertebrae attach. These are going to be where ribs attach. And these three features are unique to the thoracic vertebrae. Another way that you can remember thoracic vertebrae is they kind of look like giraffes. It's not the best way to identify these vertebrae on a practical quiz, but if you're in a pinch, this might help you out. We've got our transverse processes, our superior articular facets, and then our spinous process here. Moving into the lumbar vertebrae now. Again, we do not have transverse foramen, all right, and we also don't have costal facets, and that makes sense because we don't have rib articulation at our lumbar vertebrae. We still have a spinous process, okay? It's not as sharply facing inferiorly as did the thoracic vertebrae. It's relatively linear, it's relatively flatter. And notice that the superior articular facets are facing medially now. The cervical vertebrae were facing superiorly, the thoracic vertebrae were facing posteriorly, and now the lumbar vertebrae are facing medially. And this is unique to the lumbar vertebrae. And then lastly, the lumbar vertebrae are going to be the biggest vertebrae. And that's because there's just simply more weight, more pressure on these vertebrae because they're lower in the vertebral column. And just as with our thoracic vertebrae and the giraffe, this is, again, not the best way to identify lumbar vertebrae, but in a pinch on a practical quiz, this might help you. Lumbar vertebrae sort of look like moose. So let's compare these, just do a quick comparison of these vertebrae and highlight some important features here. So for our cervical vertebrae shown on the top here, we've got our transverse foramen. That's unique to cervical vertebrae, and the bifid spinous process. That's unique to cervical vertebrae C3 through C7. And we also have our superior articular facets that are facing superiorly. For our cervical vertebrae shown in the middle here, this is where rib articulation is occurring. So we have superior costal facets, inferior costal facets, and transverse costal facets. This again is where ribs are articulating, and this is unique to thoracic vertebrae. And then also our superior articular facet are facing posteriorly. These are features where vertebrae are going to connecting. It has nothing to do with rib articulation. It's all about vertebrae articulation. And then finally, for our lumbar vertebrae, it's it has the biggest body relative to the other two regions, and our superior articular facets are now facing medially. And just to recap the things that you're looking for on each of these vertebrae, when you pick up a vertebrae, ask yourself how many foramen does it have? If it's got 3, it's a cervical vertebrae, and if it's got a bifid spinous process, you know it's cervical vertebrae. For thoracic, you should ask yourself, does it have costal facets? If you see 3 costal facets, you know this is all about rib articulation, and this is thoracic vertebrae. And then for lumbar, it's relatively larger body. It's only got 1 foramina and no costal facets. Okay, now we're moving into the sacrum. The sacrum are made up of 5 individual sacral vertebrae that fuse together by the age of 26. And this bone forms kind of this wedge shape. And this makes sense because there's going to be a lot of weight put on this bone. And so we need to have a strong area where this weight, that can support all this weight. And we have our superior articular facets here, and this is going to articulate with the inferior articular facet of the 5th lumbar, the lowest lumbar there. We're showing the individual sacral vertebrae here with these transverse lines. This is where the fusion has taken place. And then these holes here, this is an anterior view, so we call these the anterior sacral foramina. Let's look at the posterior side of the sacrum. We have our superior articular facets here. This is where the lumbar vertebrae is going to articulate. These foramina now, since we're on the posterior side, we call them the posterior sacral foramina. The sacral canal, this is where the spinal column is going to be. And we also have this auricular surface. And this is part of your SI joint, or your sacroiliac joint. And this is where your 2 iliums are going to articulate with the sacrum. And if you ever have a tight lower back and you've gone to a physical therapist and they told you have an SI joint issue, this is what they're referring to, that sacroiliac joint. Now we're looking down at the lowest part of the vertebral column, and this is called the coccyx. And the coccyx is made up of 4 small vertebrae that fuse together by the age of 30. And this is a vestigial trait. A vestigial trait just means that it's something that our evolutionary ancestors had, and we've maintained that but lost a function of that trait or for that trait. And so this is why we call it our tailbone, because our ancestors had tails, but through the process of evolution we have lost that trait. But we still maintain a few of those vertebrae. They fuse together, but their main purpose now is their attachment points for muscles. We're kind of switching gears now, and we're talking about the hyoid bone. And the hyoid bone is found in the superior portion of your neck, and we call this the floating bone. And we call it that because this is a very unique bone in that it has no bony attachments. The only thing that this muscle is attaching to are muscles and cartilage. We're switching gears again, and now we're talking about the thoracic cage. The thoracic cage consists of your thoracic vertebrae, all of your ribs, and your sternum. And the function of your thoracic cage is to protect vital organs such as your heart and your lungs. First, let's talk about our ribs. We have 24 ribs in total, 12 on each side. And we number them starting with the most superior. This would be rib number 1. And we number them down to rib 12. This is the most inferior. Now, on a practical quiz, you will have to know right versus left. And we'll give you some tips on that in a minute. Ribs 1 through 7 are called true ribs. And that's because they attach directly to the sternum via hyaline cartilage. Ribs 8 through 12 are called false ribs. And this is because they do not directly attach to the sternum via hyaline cartilage. They connect to other hyaline cartilage, which then connects to the sternum. And then ribs 11 and 12, shown down here, those are called floating ribs. And that's because they do not attach to the sternum at all. Now for ribs, like I said, you do need to know right versus left because you have 12 on the left side, 12 on the right side. And the easiest way to do that is by knowing 3 features: the superior and inferior articular facets, and the articular facet for transverse process. This is where the ribs attach to the vertebrae at these 3 features. So these collectively are known as the head. So the head is going to connect to the vertebrae. And so this is the posterior portion of the rib. This end is the anterior portion of the rib. And to determine right versus left, the best way to do this is to find the articular facet for transverse process, which is shown here. And this feature needs to face inferiorly. And so with that in mind, we are looking at a left rib. And this is the easiest way to determine right versus left. Now let's dive into more detail about rib articulation. On this top image, we're showing thoracic vertebrae 5 and thoracic vertebrae 6, the vertebral body of those. This coming in here is the rib. Okay, we know that the inferior costal facet is here on T5, and the superior costal facet is here on T6. And what do we notice about this rib? Well, it's coming and it's touching in on 2 different vertebrae. It's coming in between 2 vertebrae. And the features on the rib that are articulating at the vertebrae are the superior articular facet and the inferior articular facet. And so this is kind of switched. All right, this is a little counterintuitive, but if we know that the rib is going to touch 2 vertebrae, this makes sense. So the inferior costal facet of this vertebrae articulates with the superior articular facet of rib 6. And the superior costal facet of this vertebrae articulates with the inferior articular facet of the rib right here. Now, what about that transverse costal facet? Well, that's going to be on the transverse process. And so the feature on the rib, the articular facet for transverse process, is going to connect to the transverse costal facet. That makes a lot of sense. Now, to summarize this, I know it seems pretty jargony, okay? But this slide is going to be your best friend for rib articulation. Okay, so there's 3 features on the vertebrae and 3 features on the rib that you need to know connect. All right, so on the vertebrae, we've got the inferior costal facet, superior costal facet, and transverse costal facet. Notice that the features on the vertebrae are all called costal facets. All right. Now on the rib, you've got the superior articular facet, inferior articular facet, and then the articular facet for transverse process. Okay. These are lined up with where they connect. So again, this slide is going to be your best friend for rib articulation. Okay, so I just want to note something here regarding rib articulation. All right, vertebrae features are called costal facets, and rib features are called articular facets. All right, recall that vertebrae also have articular facets, but remember, with rib articulation, this has nothing to do with ribs. Articular facets on vertebrae connect with other vertebrae. They do not connect to ribs. Okay, and then finally, we're going to discuss the sternum. The sternum is made up of 3 fused bones. We have the manubrium here, and then the body of the sternum, and then the xiphoid process. For those of you who have taken a CPR class, you know that the xiphoid process can become easily fractured when you're doing CPR. And this is why they tell you, the CPR instructor tells you to go a couple of fingers above that xiphoid process so that you're really doing those compressions on the body of the sternum. Some other key features here. Up on the manubrium, we have the clavicular notch. This is where your clavicle is going to connect to the manubrium. So if you were just to palpate your clavicle and follow it across, you can feel that clavicular notch there. You also have the suprasternal notch, which if you were to palpate up your sternum, you find this U-shaped feature right at the superior portion of your manubrium, and this is your suprasternal notch. Your sternal angle is right where the sternum, the body of the sternum and the manubrium fuse together. And then these costal notches right here on each side of the body of the sternum. This is where that hyaline cartilage from the ribs are actually connecting directly to the body of the sternum.